Well, I think most of us are aware of this fact that the medical debt is probably a bigger strain on your conscious or mental health than even the pandemic. And that's what people are saying now is that people can afford health care or medical bills, hospital bills. I mean, it's just crazy out there. And here's another interesting thing that bankruptcy now is the biggest reason people go bankrupt is because of healthcare bills. Look at 2/3 of people who file for bankruptcy, 2/3, 67%, cite medical issues as the key contributor to their financial downfall. So this is what's leading our country into depression now. But the problem is that we have programs that can pay for this. There's something called charity care, and this is a law that hospitals have to follow and forgive your bills, but you have to ask for it. Now, it's not all hospitals, and it's um, and that's the important thing is it's only nonprofit hospitals and also government-run hospitals. They have this, but that's like what 60? No, I'm sorry, 80% almost, like 78% of all hospitals I have this charity care. And they're supposed to put signs in the hospital so you know to ask for it. And the other requirement is there's income uh, to it. So you can't be a gazillionaire and ask for it and complain. But here's what the income goes to. Look, California, you can make up $91,000 and be eligible for forgiveness. Colorado has $65,000. Usually it's about $80,000. Now it may not be all. It's all forgiven if it's like $50,000 or $60,000. After $50,000 or $60,000, again, it's a sliding scale whether you get it all or part or whatever. Here's an interesting thing. The Kaiser Foundation has, I don't know what happened to my video here. The Kaiser Foundation did some data on hospital bill collections. They send it to collection agencies, and when they can't collect, then it becomes bad debt. Now, what they did is went down and see how much of that bad debt that they claimed, they couldn't get paid for could have been forgiven or actually should have been forgiven that is covered by this law. So almost like 100% of that stuff that they had to clear as bad debt, and so probably beat on these people so they got sick again and had to go back to the hospital, is covered by the law that they didn't have to do that. So the collection agencies made money, and everybody, except the consumer, right? That's what happened there. Okay, so what do you, oh, okay, this is, oh, I showed you that one before. Okay, this is a link, and I'll have all these links in the description here of other ways to pay for your medical bills. Maybe it's more than hospital bills or whatever. And there's a couple of good nonprofits in here. HealthWell is a very good foundation that helps people pay bills, and the PAN Foundation, Patient Access Network. Both of those have money for co-pays and all kinds of things. So check with them too. And there's local nonprofits too that usually help with medical bills. And if you go to 211.org or findhelp.org, you can find local nonprofits that help you do that. And there's an interesting group called Dollar For, FOR, DOLAR.org. they get your bills paid for. They pay, they raise money to get people out of bad debt. So check with them and see how they could help you. What they'll do is go and see the collection agency after they try to collect your money and they can't. Then they have like bills that are worth nothing. So they go and buy those bills like for a penny on the dollar and buy like a $50,000 worth of medical bills that can't be collected for a buck and a half or whatever, and forgive them all. So it wipes it all away, and it's no longer a bad debt because they got some kind of money for it. So that's what you have to know. Look at this and remember charity care. So that's like $60,000 or less. You're a charity, and about 80% of the hospitals have to do it. And it's a law. It's not something they're doing for the good of their hearts. It's good. They're doing because they don't have to go to jail. That's a real motivator. So there's always one way to solve the problems, and healthcare really is a big problem still in our country. Even Obamacare, we got, I think, 10 million people at least on a plan that wouldn't have been before. But there's a lot of work to do in that, and it's going to affect your life daily. Talk to you soon.